thought I would share some tips with you that I have learned along the way. Might help you as well. So, here's one for you. I should say most all of these I got at the dollar store, so they don't cost a whole lot of money. These are those pink sponge curlers that your great-grandma used. So, we're not going to use them in their hair though. What we're going to do is take this and put this over a spoon or a fork like this. So if you have one of your clients that is having difficulty manipulating their utensils, holding it and having the grasp, because perhaps they have arthritis or perhaps they've had a stroke or something and they don't have a good grip, these work great. You just slide it right over that and they can hold it much easier. How great is that? And this was $1 for 8 of them. So that would last you quite a bit of time. Okay, and then when they're done, you can take that off, wash the spoon. When this gets dirty, it can be washed. When it gets really gross, throw it away, get your next one. So there's one little tip. Here's another tip. I got this at the dollar store also. It's a shower curtain. And it was $1, so I'm sure it's really high quality. But it works great. You know what else works? Those little plastic tablecloths. You can use that as well. I like using these for a client that I have to give a bed bath to. Bed baths are tough, and you can get the whole bed wet. I mean, and you don't mean to, but things happen and splash and whatnot. This is fantastic for you roll your client to the side, put this out, roll them back, roll the other side out. You can give them their bed bath and roll them back, and they're on their clean sheets again. This is also great if they only have one set of sheets, and you can put this out, and as you're rolling them over, you tuck the sheet underneath, and then you roll them the other way, pull the sheet out, pull this over, take the sheet and throw it in the laundry and get that going. Give them their bed bath, maybe get them up in the easy chair or whatever you're doing, and by the time you're ready to leave, the sheets are done. Put them back on the bed, take this out, everything is great. So these I have found to come in very handy. However, remember infection control. This must stay in that one client's home. You can't take it from Frank's house to Hilda's home. Okay, this is per client. Another thing that I used a lot of was a lint brush, because if you're in a client's home and they have a cat or a dog and you go to leave, I know I worked for a company that we had to wear navy blue, and one of my clients had a white cat, and boy did it show up. And so I'd get back in my car and I'd make sure all that cat hair was off of me, pull it off. You know, these have the little layers of paper on there, and you can dispose of it so it stays clean and you're not contaminating anything. I found this to be very handy. You're probably wondering what this is. This is something that I came up with because, necessity is the mother of invention. Something was needed. And I was in a client's home, and she was part American Indian, and she loved her long, thick hair. And she was actively dying, and there was no way I could get her into the bathtub and wash her hair. And I kept thinking, what can I do? The family did not have money to buy one of those hair washing devices that you use in bed. Not only that, they don't work real well. I've always had trouble with those. And those, again, are patient specific. So those $45 that it costs for that, that would have to stay in that client's home, and that was not going to work for this situation. So I came up with this. This is just one of those little floaty life preserver things that you can get at the dollar store. It was $1. And this is just a garbage bag. You can use any garbage bag. If you want to use a nice, the 13-gallon kitchen bags work great in it. But you open up your bag and you put it right through like that. Then you go like this. Like that. See? And then you're going to put this under the client's head. So their head is resting right here. Okay? This will hold a good 42 ounces. So you can put the client's head in there. Now, usually what I would do before I did this, I would put the shampoo and take a washcloth or a sponge and work it through their hair first. And then when I laid their head in here, then I would pour more water in there, work up a lather, and then rinse it quickly. That seemed to really work. Then you pull the head up, you have a towel underneath this, lay the head down with the towel, cover up their head. All the water comes down into this, and you just support the bottom of it, put it off to the side, and then you can dump that water out. It works so well. It doesn't take very many breaths to blow this up. It should probably be resident specific. I don't know that it would have to be, because this could be sanitized and the air let out of it, and you could take it from home to home and just use a different bag. That, to me, would pass inspection, I believe. But follow your facility or your agency's protocol on that. Another little tip that I want to show you is something that I started using in home health, and then I brought it to the nursing home and started using it there. Now, this is one of those super inexpensive little throws that you buy after Christmas. You know, they have them on clearance at Walmart for $2. So whenever I see those every year, I would buy just a handful of them. Then, diagonal, do you see how this is? I cut a slit diagonal in it. And this slit is big enough to fit your head through, okay? So the way I use this is when they need to take a shower and perhaps they do not have a zero entry shower at their home, maybe they cannot get in the shower, or perhaps they can, but they're just so cold-blooded, they don't want to take a shower, they don't want to take off all their clothes, they're cold. This works so good. You can just slip it right over their head, like such, and it becomes a poncho, like this. Then you set them on the toilet, you get your basin of water, and you can just give them an excellent bath right there. They are not sitting there naked. You're not trying to wrap a blanket around them or a towel. How great is this? Hands-free. They can just have this on them, and they can even help wash themselves. And you can get access to all areas of their body, yet they are covered and warm. It's inexpensive. They may even have one of these little throws at their house. Don't cut it until you get permission from them, of course, and from family or whoever you need to get permission from. Now, this would be client specific. You wouldn't want to take this from one home to another, of course. But gosh, I have just found these to be a real help. And even for my folks that did not want to get in the shower, they can sit on the toilet and you can just wash them up real well. You can even, if they do get in the shower with this, you can even use it like a giant washcloth, right? You could do that. You're going to wash it anyway. There'd be no harm in that. And at least then, they're not cold and naked and exposed, or You know, some people are very modest and they don't like that feeling of being exposed. Especially I've seen it in some men that I've had to take care of, or vice versa. They may feel that way, and this can help with that. And then you may even have another one where if you took off the wet one and then put on a dry one, that's a possibility as well. But I just wanted to share that with you because I have found it to be something that's very helpful. Okay, next thing I want to show you, perhaps you've used one of these before. They come in plastic or wood. This is called a transfer board. Do you see how it tapers down like this? Okay, and it's got handles. Okay, so what we would use this for is transferring, the thing I love using it for the most is transferring someone into and out of a car. Wow, I love it because cars usually sit pretty low, and I can put them from their wheelchair into the car and slide them down. Now you always want gravity to help you. If I'm getting them out of bed, and if they have a hospital bed, I'm going to put that bed just a couple inches higher than the wheelchair so I can slide them down. It's very effective. And then when I put them back into bed, I'm going to make that bed a little lower than their wheelchair and slide them down again. So this is a piece of equipment that's not too terrible expensive. They may have one in the home. If you don't know what it is a transfer board, and you might find it very, very helpful. By the way, use a gate belt. If you just have a cloth gate belt, it really should be client specific. If you have one of those new nylon ones that can be that can be disinfected and cleaned, then you can just clean it in between each client. That's fine. But lots of times you are alone. You're the only one in that home besides your client, and you must use very good body mechanics. You need to be careful, and sometimes there'll even be mechanical lifts in the home that you have to use alone. And you might say, Diane, I was told never to use a lift alone, to always have a second person. You're right. That is what you need to do in a hospital or a nursing home. But in home health, you don't always have that luxury. And sometimes, and the regulations are different for those. And sometimes you do have to use that alone. And so you need to think through everything you do very carefully and thoroughly before you start doing it. So if you're moving someone from one space to another, think it through. Is the path clear? Do I have everything locked? Is everything positioned correctly? Do I have enough room to turn this around? Do I need to move something? How about tubes? Oxygen, catheter, several things like that. Think about those before you move it, okay? Those are all things to consider. Here's another item I really like. This is called a pivot board. They're about $35. If you have, and again, because you're alone and you don't have anyone to help you sometimes, then you need some equipment to make your job easier. And this is a pivot board. This would be where your client would stand on this and then you pivot them. So you would put this on the ground, you would help them stand, and then you could turn them to sit in another position. This works for getting in and out of a car. This would work for going from the bed to a wheelchair or something like that. Okay? That's your pivot board. This could go from one client to another, but it would have to be disinfected in between each one, and that might be a little challenging. A draw sheet. All you need is a top sheet. If they have an extra top sheet, doesn't matter what size it is, twin sheet, double, doesn't matter, fold it in half and you can use it as a turn sheet. You can use it to help you turn your client. It doesn't have to be a designated draw sheet or clean or turn sheet. It can just be any top sheet you can use for that reason, for that purpose. So I hope that helps. I've gone over several different things that you might find to make your job easier. Adaption, innovation, coming up with things that'll work for you is critical when you're working in the home. Because again, generally speaking, it's just you and your client. And when it comes to bathing, transferring, feeding, sometimes we have to get a little creative.